she will know that the Mental Health Foundation, University of Scotland and the Robertson Trust surveyed over 15,000 students and found that 74% reported low well-being, 45% experienced a serious psychological issue that they felt needed professional help, and 36% reported either moderately severely or severely experiencing symptoms of depression. There is a mental health crisis in our universities and colleges, and I'm afraid the actions of the First Minister in cutting the allocated funds for mental health support has just made this problem worse. But she has one chance to deal with the mess she's created. She must guarantee that the £20 million four-year programme of sector support for student mental health is continued, not cancelled. And can I help her find that £20 million? How about the £20 million she's earmarked for an independence referendum that the majority of Scots don't want? So will she act now to avoid a further crisis?
First Minister. Well, I don't want to waste too much time giving a basic lesson in financial management to the Conservatives, but money due to be allocated in a future financial year cannot be used to fund services in this financial year. The fact, of course, still remains that investing a very small sum of money to give the people of Scotland an alternative to Westminster mismanagement, I think is a very good idea indeed. In terms of mental health, Stephen Kerr is right to point to the figures he has narrated in the Chamber today. It is, of course, first and foremost for individual institutions to ensure that they have appropriate mental health support in place for their students, but we're working closely with institutions to support them as they do this. As I said earlier on, we have invested more than £11.5 million to support 90 additional counsellors in colleges and universities. We are, in fact, the only UK nation to have funded student mental health support in this way. So perhaps Stephen Kerr's comments would be better directed to his own party in government at Westminster.